Hello, good evening. This is Dr. Jagannathan. Today, I would like to discuss something about thyroid disease. Because all of us know thyroid is one of the glands that are essential for normal metabolism. There are certain glands, endocrine glands, we call them endocrine glands, and thyroid is one of the major endocrine gland that is essential for the normal metabolism, normal growth, normal functioning of the body, normal functioning of the cell itself. So now, going into the thyroid is the gland which is situated in the front of the neck, just below the Adam's apple. It got a prominence called Adam's apple, and it's a butterfly shaped thin organ. And I'm not going to in detail much about the anatomy. The thyroid gland secretes one hormone called thyroxine. We call it as one is thyroxine, other one is levothyroxine. Other is called thyroxine, other one is called triiodothyronine. We commonly call as T3 and T4. T3 and T4 are the two hormones secreted by thyroid gland. And these hormones are very, very essential for normal functioning of the body. So the thyroid gland is controlled by the pituitary gland. The pituitary gland is the controlling master gland to control thyroid gland to secrete normal quantity of thyroxine. In turn, the pituitary gland itself is controlled by one part of the brain called hypothalamus. So now you must keep in mind there are two axes. One is thyroid pituitary axis, the other one is pituitary hypothalamic axis. These are the two axes we are controlling the totally thyroid gland. Because if the problem, coming to the problem of thyroid gland, just like any part of the body, a thyroid gland may be affected by congenital problems, that is birth problems, inflammatory problems, that is infection by anything, by bacteria, but chemical inflammation or viral infection. So, maybe a congenital, inflammatory, traumatic injuries. Injuries can also damage the thyroid gland, and then you got the malignancy, cancers. Any type of cancer you can get in thyroid gland. And lastly, we got the autoimmune disease. Any autoimmune disease can affect the thyroid gland. These are the 5 major classes of problems that can affect the thyroid gland. Now, our concern is the ability of the problem that interfere with the secretion of the thyroxine, secretion of the thyroid hormone. We are not going to any other detail. See, thyroid hormone secretion is a normal secretion, is essential for normal metabolism or normal living. So there are two situations. One is called the thyroid gland is not secreting adequate hormones. That is called hypofunction. That is called hypothyroidism. So my topic is going to be hypothyroidism today. Other one is the gland may secrete excessive amount of thyroid hormone. That is called hyperthyroidism. So commonly hypothyroidism is known as the inadequate thyroid hormone, inadequate thyroid stimulating disease. Hyperthyroidism is otherwise called Graves' disease. I am not going to go into the detail. Now, coming to hypothyroidism, when the thyroid gland does not make enough thyroid hormone, because this may be due to so many reasons which I am going to enumerate. Now, whenever you have a hypothyroid state, or when your the thyroid gland is not secreting adequate hormone, you will have certain symptoms. So when you have the symptoms, you will have to consult a doctor and you have to make a diagnosis. What is the problem for the hypothyroidism? Hypothyroidism can be due to many reasons. Then you have to, after diagnosis, you have to go take the adequate treatment, proper treatment. Then you have got follow it up, because hypothyroidism is a disease for which you have to take lifelong treatment. Once you become hypothyroid means lifelong you have to continue your supplementing thyroid hormone. So you have to be watchful so that periodically you are assessing your thyroid state. So that will keep your metabolism in a better state, in an adequate state, so that you don't have any symptoms and you live a normal life. Now, when you have a thyroid disease, before that I want to emphasize one, the thyroid hormone, this consists of two parts. One is an amino acid, tyrosine, and the other one is an element called iodine. Iodine is responsible for thyroid function, thyroid secretion. Iodine is the main component of thyroid hormone. So whenever there is an iodine deficiency, places where the sea salt is not available, the people will be taking rock salt. The rock salt does not contain iodine. So that is one situation. When those people will be more prone for hypothyroidism. Now, we are all living in the coastal areas. We don't have much of iodine deficiency. And nowadays, most of the salt, the commercial salt, they are enriched with iodine. Okay. Now, iodine is an important element. It's a halogen, isn't it? Iodine is a halogen. It's an important element for thyroid secretion, thyroid production. Now, when you have hypothyroidism, maybe due to whatever reason, what are the symptoms? When you be an adult, when become hypothyroid, the most common symptoms are tiredness. They always feel lethargic, tired, and most sensitivity to cold. They got a sensitivity to cold. Even a smaller amount of drop in temperature, they feel very chill. Constipation. See, they got a constipation because decreased mobility of the intestine. Dry skin will be dry and scaly. Weight gain. This weight gain is because to accumulation of one type of tissues called myxomatous tissues. Myxomatous tissue is something like a fat that will be accumulating under your skin, so you get a weight gain, and you will also look obese. Puffy face. That's another. It's again the puffiness of the face. The face will be bloated. That is again the mistiness, the myxomatous substance. Hoarse voice. Your voice will be hoarse. You lose the sweetness of your voice, and coarse hair and skin. Your skin and hair, they become coarse. There will be muscle weakness. There will be muscle aches, and tenderness and stiffness. Whenever just to press somewhere, you get the pain. Then in young ladies, menstrual cycle, they will have heavier than usual and irregular. The menstrual flow will be heavy and the menstrual cycle will be irregular. Then there is a thinning of hair and there is bradycardia. The heart rate will be reduced. We call it bradycardia. Usually the heart rate should be between 60 to 90. Sometimes it may go up to 45, 50. So the heart rate will be reduced. And depression. Depression is a very important part of hypothyroidism. Then memory problem. There will be loss of memory and sometimes people may go for amnesia and other things. Okay. Now, what are all the causes for hypothyroidism? Now, hypothyroidism is an autoimmune disease. The major cause is autoimmune disease. You know what is autoimmune disease? That means antibodies are produced against our own body, within the body. So, thyroid antibodies, they are produced and they will be acting against the thyroid hormone and the cells producing thyroid hormone. So, the thyroid cells will be destroyed and the thyroid hormone will be inactive. That is called autoimmune disease. That cause is called Hashimoto's disease. That's the most important cause. Then thyroid surgery. When somebody goes in for a surgery, thyroid surgery, for example, I told you hyperthyroidism, Graves' disease. When they have had a thyroid nodule, a thyroid growth, then they go for a surgery. When they go for a surgery, sometimes they do what will a total thyroidectomy. Completely, they remove the whole thyroid gland. In that case, lifelong we will have to be on replacement or supplement. And then radiation therapy. See, radiation, it always destroys the normal cells also, because radiation is given for cancer cells. When you radiate somebody for a cancer in the head, neck or face, and these radiation will affect your thyroid also, and that will destroy the thyroid. And then next one is thyroiditis. Any itis means inflammation. Thyroiditis means an inflammation of the thyroid gland that may be due to infection, that is the chemical inflammation, that will be immunological inflammation. Any of the inflammations can affect the thyroid gland so that the function is reduced. And then certain medicines, certain drugs, especially some of the drugs like lithium. Lithium is one drug which is very enormously used in psychiatric treatment. So lithium will mar the function of the thyroid gland so that you will have your secretion will be less and go in for hypothyroidism. And sometimes the problems may be present from since birth. People have congenital hypothyroidism. That is one situation where since your birth your thyroid function is not abnormal and you don't have enough of thyroid hormone. Again, I told you, then the pituitary thyroid axis, I told you, when the pituitary gland is stimulating the thyroid gland. So, all the disease I was referring to they are called primary hypothyroidism. It's called the problem is in the thyroid gland. So, now the next one is pituitary disorders. That is called the pituitary thyroid axis that is disturbed. So that the stimulus from the pituitary gland, that is TSH, thyroid stimulating hormone, that is it's not a thyroid hormone. Please remember, we always estimate TSH, T3, T4, but TSH is a hormone from the pituitary gland, not from the thyroid. So the thyroid TSH is very essential for the secretion of T3 and T4, and diseases of the pituitary will affect the secretion of T3, T4. Then you have gone for hypothyroidism. This is called secondary hypothyroidism due to disorders of the pituitary disorders. And there is one a tertiary hypothyroidism where the hypothalamus that will not be sending signals to pituitary. So the pituitary will not be sending signal to thyroid. So you become the hypothyroid. This is called tertiary hypothyroidism. And this due to because hypothalamic pituitary axis disorders. And pregnancy. In pregnancy, sometimes people may go in for hypothyroidism. The eclampsia and preeclampsia and all these things, there will be raise in blood pressure. And hypothyroidism may occur because there may be an increase in the thyroid demand during pregnancy. And when there is a hypothyroidism, that may affect the development of the fetus. Okay. Now, lastly, I was telling about iodine. Iodine is the most important substance for synthesis of thyroid hormone. When there is a deficiency in iodine, that is iodine deficiency, especially iodine is taken from the salt, sea salt. Now, sea salt contains adequate iodine. So, when in places where the salt doesn't contain enough iodine, the people will go in for hypothyroidism. Okay, these are all the causes for hypothyroidism. Now I am going to talk to you about what are all the risk factors to develop, who all have the risk to develop hypothyroidism. So, first one is if you are a woman. So, the hypothyroidism is more common in women than men. Okay, then family history. If there is a family history of hypothyroidism in your parents, in your maternal uncle, your aunt, people, blood related people or first and second degree relatives, then you have likelihood of developing hypothyroidism. And people have got other autoimmune diseases. I told you the Hashimoto's disease is an autoimmune disease. So if you have other autoimmune disease like type 1 diabetes and celiac disease, these are some conditions which are autoimmune. So they can also, these people having these things also can go this autoimmune disease also. Then if you are reviewing treatment for hyperthyroidism, see, I told you excessive, when there is an excessive hormone called as hyperthyroidism, Graves' disease, where you give drugs to suppress the thyroid hormone. Then also you can go for hypothyroidism or radiation. I have told you radiation, people who are susceptible to radiation, that will destroy the thyroid gland and the cells. And thyroid surgery. Okay, people have undergo for total thyroidectomy or partial thyroidectomy, whatever it is. And these people are likely to they have all the risk of developing hypothyroidism. And the complications, see, I told you the goiter. Goiter is a big mass, the swelling in the neck, in front of the neck. You are testing a lot of people having big goiter and heart problems. So hypothyroidism will reduce your heart rate. So your heart rate will go down. I told you in the symptoms. Then peripheral neuropathy. People with hypothyroidism, they have peripheral neuropathy because I told you lot of myxomatous tissues, they will all encircle the nerves. When they encircle the nerves are compressed and you will go for nerve problems, nerve pain, tingling, burning, vague sensation. These are all signs of peripheral neuropathy. Then infertility. The people who are hypothyroid, most of them, they are infertile. They don't have, their fertility is low. Then birth defects. Though, if you are a hypothyroid and if you have a child, your child is likely to have birth defects, cretinism, something like that. And then the last important thing is myxedema coma. This myxedema coma is a very grave condition where the patient goes in for coma because of all metabolic activities will decrease at one stage of hypothyroidism. That we call it as myxedema coma. Now coming on to the diagnosis and treatment. See, diagnosis of thyroid is only by blood test. We know the clinical symptoms. Thyroid is one condition where doctors can make the diagnosis even just by looking at your face. Looking at your face, you will say you are myxedema because it's such a florid and very familiar condition. And you have to confirm it by blood test. Only there are three things you measure: TSH, T3 and T4. TSH is not thyroid hormone. This is thyroid stimulating hormone from the pituitary. And T3 and T4 are the hormones secreted due to the stimulation of the gland by TSH. Now, the diagnosis of thyroid disease, especially myxedema, the most important part is TSH, because I told you without TSH stimulation, thyroid gland cannot secrete T3 and T4. And there is a feedback mechanism. Whenever there is, when the TSH is normal, then the T3 is normal, T4 is normal, it is a normal picture. Whenever there is a decrease in T3 or T4, so what happens, the thyroid gland will send signal to pituitary, so the hormones are going down. You send more of TSH, more stimulus. So, when the T3 and T4 goes down, TSH will go up. Okay? So, in the typical picture of myxedema or hypothyroidism is low T3 and T4 and high levels of TSH. And in the other way, in Graves' disease, whenever there is an excessive amount of T3 and T4 secreted by the gland, that will send signal to the thyroid saying, I got excess of T3 and T4. In that case, the pituitary gland will stop sending signals or reduce amount of TSH will be secreted. So that is the feedback mechanism. So you measure the T3, T4 and TSH, and depending upon the values, we have to come to a conclusion what we have to do. There is a problem, whether it is a primary thyroid hypothyroidism or secondary hypothyroidism. Depending upon that, we make the diagnosis. And finally, coming to the treatment is the replacement. Only levothyroxine. The only drug, levothyroxine, L-troxin or Thyronam. Even though it comes in different names, Levo-T, Synthyroid, all these things. They have different names, but the drug is only one drug, levothyroxine. So, that's a replacement drug for thyroid deficiency that is given in the empty stomach, that is given in the morning. And don't take anything for a half an hour after taking the drug. You have to continue your drug lifelong. And people taking T3, T4, levothyroxine, they have to have periodical assessment. And once your symptoms are stabilized, you need not test T3, T4. Only TSH will help you. If your TSH is normal, that means your T3, T4 is also normal. Whenever there is a change in the TSH level, then we will have to assess the T3, T4 level also and correlate the feedback mechanism. So, periodical assessment maybe once in 6 months or even once a year if you are asymptomatic, but never forget to take the tablet, because thyroid substitution is lifelong. Because I told you, either the gland is lost, either the gland is removed, or the gland is destroyed, or by since birth you don't have the gland. So all these things will always suggest you must take a complete lifelong treatment for thyroid gland. So this is a picture about the hypothyroidism. But the hypothyroidism, even though it is a bad disease, we can be controlled, we can be managed, and we can have a normal life with the adequate treatment, adequate examination, adequate and proper interpretation of the results, and with the guidance of a good physician. Okay, thank you very much. I conclude this topic today. I will meet again with another important topic after some time. Thank you, Dr. Jagannathan.